grateful to you all for taking your time to come and be here for this today. I am part of the organization that has been rather newly organized called Locals for Good, and we are organizing around a variety of issues that we think are really important to the community at this particular point in history. In particular, Medicaid right now is something that struck us as being something that was incredibly important to start, particularly considering who our representative is. John Joyce holds committee roles in Congress that make him a particularly powerful actor when it comes to the issue of Medicaid. And I recognize some faces. I know some of you all were at the town hall that was held last week. Some really powerful stories were shared at that time. From people that use Medicaid, or for whom Medicaid has meant something important to themselves and their families. And one young man pointed out, this is the bare minimum. This is the bare minimum of what we need as a society to thrive. And given the way the budget has been developed, it is very hard to see how it's not going to be cut significantly. And so the next step, we thought, was to have this particular forum where we have some people from experts from the community coming in to share their expertise, their knowledge, their background about what Medicaid means here. And because everything that Locals for Good does, we're trying to keep a very local focus on this very national story. So I really want to thank and acknowledge all of our panelists for agreeing to come and talk about this. It's challenging. Really want to appreciate Chip Mittemeyer for coming in and moderating for us. So with that, again, also, you all should have received a piece of paper that has some information about Locals for Good. It has our website. You can go there and sign up to get email about what we're doing, what's next. There's also information about a rally coming up next Saturday. So we hope you all will join us then. In any case, with that, I'll turn it over to Chip. Thank you so much.
Thanks, Shelley. Hi, everybody. How you doing? Thanks for coming out this evening. I think this is extremely important, and hopefully all of you came armed with questions in addition to curiosity, because we're going to try to answer everybody's questions tonight. Shelley mentioned the sheet of paper you all got. There's a QR code at the bottom. If you scan that with your phone camera, you can send questions, which will then be forwarded to me, and one of my jobs tonight will be sort through them and ask questions to make sure we have a good representation of what the mood of the room is and what you all want to know when you leave. And also, as Shelley said, we have a great panel here. I'm going to introduce them real quickly. Again, my name is Chip Mittemeyer. I'm the Tribune Democrat and a publisher, and I'm honored to be here to work with these folks. I am not one of the experts she referenced. That's the rest of the folks to my left, to your right. And real quickly, let me introduce those folks to you. Starting at the far right, Rosalie Danchanko has served as Executive Director of the Highlands Health Clinic, which provides medical care to uninsured and underinsured people for 12 years. Rosalie is also the founder of Victim Services in Cambria and Somerset counties. Rosalie, welcome. To her right, Jason Rilogio is an advocate for mental health and substance use recovery. He's a regional delegate for Cambria County Community Support Program, co-chair of the Pennsylvania Office of Mental Health and Substance Abuse Planning Council, and a voting member of the Cambria County Drug and Alcohol Program. He'll talk about this in recovery himself. Jason's certified community health worker and is organizing a town hall that we just held and has been very involved in this whole process. So, Jason, thank you. Next is Karen Struble Myers. She's the president and CEO of United Way of Southern Alleghenies. She's been here since March of 2020. She is responsible for planning, organization, development, and execution of the United Way strategic and operational tactics to meet key health and human services needs in Blair, Cambria, and Somerset counties. Karen has spent more than 25 years in the nonprofit sector in a variety of leadership roles. Karen, thanks for being here. Next is Jeannine McMillan, who's the Executive Director of the Center for Population Health here in Johnstown, a resource center that works to prevent disease, reduce health disparities, and improve the overall health and well-being of Cambria and Somerset County. She's worked in public health for the past 16 years, previously serving as a manager for strategic planning for Conemaugh Health System, and she's been very instrumental in a Tribune Democrat series we've been rolling out, looking at the impact of potential federal cuts. So thank you so much. Welcome. And then to my immediate left, James J. Cook, has served as Executive Director of Cambria Residential Services since 1984. He's a fellow in the American College of Healthcare Executives, holds a master's degree in public health, and a master's degree in public administration from the University of Pittsburgh. Yay. Has leadership roles in intellectual disability and behavioral health services for 40 years, honorary board member of the Rehabilitation Community Providers Association of Pennsylvania. Jim, thanks for being here. And really a good place to start is some data and some real local community information I think you'll find very interesting. And I'm going to hand it off to Jeannine, who has a slideshow, and you can begin putting those questions together as she rolls out some of this information for you.
Come back here and look at the screen, but then I can't see all of your beautiful smiling faces, so I'll stick it over here on the side. Good evening, everyone. Thank you again for taking time out to come here to ask questions, to learn more about what we could potentially be facing with any type of Medicaid cuts. I get the privilege and honor of sharing data with you all, and I know that public health data is not always the sexiest topic or the most interesting topic, but in light of some of what we're seeing and some of the potential challenges, it's really so, oh, sorry, thank you. Can you hear me? I really think that it's just important to really level set and provide some of this high-level data that really sets the stage on where we are as a community. Our agency works in both Cambria and Somerset County, so when we talk about the community, we'll be looking at that two-county region from a data standpoint. So, so what does Medicaid cover? I think sometimes when we talk about Medicaid, not a lot of folks really recognize what a plethora of services fall under that umbrella. And you can see here we've captured the laundry list of just some of the services that are required from a federal standpoint to be provided at the state level. You can see here they run the gamut not only from inpatient hospital services, outpatient hospital services, home health, rural health clinic services, federally qualified health centers, and then on to transportation for medical care, freestanding birth centers, midwife services, and family planning services. So it really is a large umbrella of what falls under Medicaid services. As it says here, you can see here some of the Medicaid benefits are required by federal law, others are optional. There's a whole other list of those if you want to look for those online. And states must provide those certain mandatory benefits on the right-hand side, and then they can choose to offer those optional benefits. So from a demographic standpoint, again, looking at that two-county region, you can see here some of the coverage statistics. Medicaid coverage in Cambria County, 27% of our population relies on Medicare coverage for their healthcare services, with 22% of the population in Somerset County. We added on here those individuals, our seniors that rely on Medicare coverage at 23% in both counties, and those individuals that are uninsured. And when you add those up, over half of our population really relies on government benefits or uncompensated care from a hospital perspective in order to get any type of treatment that they might need. Again, looking at some of the other demographics in the community on the right-hand side here, we do have an aging population in both counties with over 23% of our populations at over 65. That's compared to the US average of close to 17%. From a socioeconomic standpoint, our poverty rates in Cambria County, we have almost 17% of the individuals in Cambria County who fall below that poverty line. Somerset County, a little over 14%. And again, when you compare that to some of our statewide statistics, 11.8% of the individuals in the state fall beneath that poverty threshold. So a high number of individuals really rely on those benefits from a socioeconomic standpoint. High number of children in poverty. We'll talk a little bit about some of that CHIP coverage as well for children that may need that coverage. And individuals with a disability diagnosis, over 18% in Cambria County and close to 17% in Somerset County. So you can see here some of the other data that we've included on the slides here. About 750,000 Pennsylvanians have health care because of Medicaid expansion back in 2014. That's more than 2.5 million who have received coverage at some point during that time period because of Medicaid expansion. Since March of 2023, when Medicaid had their continuous enrollment due to the COVID pandemic, Pennsylvania has disenrolled close to 900,000 people from the program, about 33% of whom have completed their renewal forms. So we know that there are some challenges there with that re-enrollment, and we'll talk a little bit about that here this evening as well. So every 3 years, our community performs an exercise called a Community Health Needs Assessment, and essentially it's a way for our health and human service providers and the community to really get a pulse on what the needs are from a data-informed perspective. So we look at all of the public health data that's out there, and we mirror that with surveys. We get individuals in the community to execute surveys sharing what they feel are some of the biggest challenges in the community. And we mirror that public health data with those survey responses and really try to focus what our efforts should be. And back in 2022, the last Community Health Needs Assessment that was done, we had identified 7 priority focus areas that we as a community should be looking at in order to help move the needle and get folks healthier within our region. And you can see here, I don't think this list is a surprise to anybody in this room. Physical health, socioeconomics and job training, social determinant of health needs and health care, mental, behavioral health, substance use, early childhood, and violence, abuse, and safety were the 7 buckets of priorities that were identified that we should be focusing our efforts on, focusing funding, focusing programming in order to, again, help to improve the health of individuals in our community. And we want to share a little bit of data in some of those bucket areas, again, that would be detrimentally impacted should we see any of those cuts in Medicaid funding. So under the physical health umbrella, hospitals and federally qualified health centers or community health centers could face significant losses or closures if those decreased funding programs proposals are enacted. And I'm sure Rosalie can speak to this as well, what that means for the patients that they serve at their clinic every day. We already have a shortage of healthcare providers. I'm sure everyone in this room is well aware of that. Some of the statistics on the screen here, primary care physicians in Cambria County, we have 1 provider for every 1,440 individuals. In Somerset County, a little bit more of a dire situation from a primary care perspective, 1 provider for every 2,700 individuals. Our state ratio much lower than both of those statistics. Looking at oral health, anybody trying to get a new dentist appointment lately? We're working on that, but you can see here the dental capacity. We only have 1 provider for every 1,400 individuals in Cambria County and 1 for every 3,300 individuals in Somerset County. So what that means is, again, as we try to recruit more practitioners to the area, when there are any types of cuts to reimbursement, we're going to see less individuals practicing, accepting Medicaid insurance, accepting individuals that may not be able to have that any type of coverage for that matter, and we're going to see less of those individuals in practice regionally. Indiana University of Pennsylvania is planning an expanded new osteopathic medical school. Again, we could see some negative impact there as well. Decreased number of individuals with coverage, less number of individuals that may go into that workforce. Home and community-based services that help people with disabilities. James will talk a little bit about what that potential impact could be to some of their work as well. And early intervention for young children, school-based therapies, and equipment and technologies are also often excluded by private insurance and covered under Medicaid. And I know Karen can speak to some of the work that's occurring under the early childhood umbrella in our community as well. Disabilities and Medicaid, again, in Pennsylvania, a significant portion of adults with intellectual disabilities rely on Medicaid for support. 92% of residents with intellectual and developmental disabilities in the state receive long-term supports and services through Medicaid-funded waivers. And nearly half of Medicaid enrollees with a disability, 47%, report having difficulty with self-care or independent living. disabilities that can frequently require long-term care and coverage through Medicaid. It is the primary payer of that long-term care because it's generally not covered by Medicare or private health insurance, as we said. From a socioeconomics and job training perspective, again, when we look at some of the local data, we do have declining incomes in both counties. Cambria County with 46% of the population living on less than $50,000 annually, and Somerset County with 43%. Unemployment rates in both counties are higher than the state and national averages. And one of the things that's not talked about a lot is with that Medicaid expansion through the Affordable Care Act, the number of jobs that were created. So not only do we have more folks that have that coverage and are getting that physical health and care that they need, but also it is a job creator. We've got lots of data that we can share with you tonight as well that shows, that quantifies that impact. But Pennsylvania could potentially lose over 61,000 jobs if that Medicaid expansion were eliminated. You can see in healthcare and other sectors. Social determinants of health, when we talk about social determinants of health, if anybody's heard that terminology, those are really some of the drivers or social drivers of health that could impact how healthy a person is, or the supports that they have in their community. So it'd be great if we had enough primary care physicians and dentists to be able to fill the need in the community. But it doesn't do us any good if we don't have adequate transportation to get folks there, or folks don't have appropriate housing or have food insecurities. So when we think about social determinants of health, those are the types of things that are under that umbrella. So one of the things that Medicaid does provide funding for is the Medical Assistance Transportation Program, funded 50% by the federal government, 50% by the state through Medicaid. Any cuts to that program would seriously impact patients, hospitals, and caregivers. And as you can see from the slide here, that MATP program provides about 3,500 trips in Cambria County and 3,200 trips in Somerset County a year for those who rely on it to access care. Food insecurity, again, is worsening in the region. In 2023, over 38,000 households in Cambria County use food pantries in the Somerset Mobile Food Bank. In 2024, the number rose to 41,000 households. So we've seen that great increase in food insecurity in our region, and anticipate that could increase as well and cause other socioeconomic challenges. SNAP, or the food stamps benefits, it really is a lifeline. You can see your 20% of Cambria County and 15% of Somerset residents, compared to the state and national average, rely on SNAP benefits for food security. And we've also shared here again, WIC and SNAP could face potential funding cuts, and we know that the USDA has ended the local food purchasing program that supported local schools and farms in our region. Under the mental health and substance use disorder umbrella, again, we know that there's already a significant shortage of mental health providers in the region. You can see some of the statistics there. And Medicaid truly plays a critical role in addressing the opioid and fentanyl crisis. Nearly 90% of the treatment for opioid and fentanyl addiction in the U.S. is funded, at least in part, by Medicaid. And increased funding has led to positive local outcomes in substance use disorder treatment and support programs. And I'm sure Jason will share some of his personal stories and work that he's doing as well. Under the early childhood umbrella, bear with me, I know it's a lot of data, but under the early childhood umbrella, again, children in Cambria County, 22%, Somerset County experience poverty at significantly higher rates than the state and national averages. We talked about CHIP coverage. Any proposed cuts to early childhood education, pre-K programs, and school lunch funding could worsen that socioeconomic situation for many of those families that rely on CHIP benefits for healthcare coverage for their kids, and will have a detrimental impact on some of those childhood poverty rates. And we talked again about some of the other supports for infections, SNAP benefits. So I'm going to leave this slide up on the screen while we get to some of the questions, but I think as we talk about what can we do, obviously the first start is you all being here this evening to share your voice and to elevate some of these potential challenges. We have our media partners here sharing and spreading the word as well. Really, again, being that voice for not only yourselves, but folks in the community that rely on Medicaid, ensuring that we have that access to health care, mental health services, the long-term supports, coverage for children. Again, you can see some of the statements here. When we invest in Medicaid, we invest in the well-being, resilience, and future of our region. Please call, email your state and federal legislators, urge them to protect that coverage, and a plug for a rally to defend Medicaid on Saturday at 1 o'clock in Central Park downtown. Any questions on the data?
It was a great presentation. We've got a quick question in the corner.
Well, I do know that, I mean, it's compounded. A lot of healthcare practitioners won't accept Medicaid patients. I think there's only one dentist who will, at New Dimensions, who will treat Medicaid recipients. So, I mean, this is still doubly compounds the statistics you're seeing here for Medicaid recipients.
It's a major problem. Does anybody want to address that, or do you want to kind of?
You're absolutely right, Paul. I think all of us have been somewhere where we will have heard we do not accept Medicaid or government funded insurances to serve the people, and that impacts who can be helped. Just took away a little bit of my presentation.
Okay.
But
Thank
I'll
you.
say it, and then I'll say it again. At our clinic, we welcome individuals with Medicaid. Would love to be able to provide the dental care, but that is a very tough problem to conquer in this community. The dental, the teeth is the gateway to a lot of health conditions. We have a lot of problems. We have a lot of concerns, and I'm hoping this forum will educate all of you enough so that we can move forward to take action.
We've begun to get questions. Keep them coming. We have a couple that we'll get to in a minute or two. Now I want to step to Jason. Do you want to elaborate on some of the points that Jeannine made in her slideshow as your specific area?
My name is Jason Rilogio. I'm a person in long-term recovery from mental health and substance use conditions. What that means to me is I haven't had a drink or a drug in over 14 years. And that is directly due to Medicaid. When I came back to Johnstown from Pittsburgh, where I moved to have a career, I had a great career. At 21, was installing multi-million-dollar sound systems. At 23, I fell off a ladder, messed up my back pretty bad. That was when opiates were heavily prescribed. Fast forward a long time later, I came back here to seek treatment, and it was Medicaid that paid for me to go to a rehabilitation center to start my recovery journey. So, that's why I have 14 years today. Medicaid also, there's programs in Medicaid, so like enter the workforce in recovery, right? I stepped down. Jeannine mentioned SNAP. I got a lot when I became a single parent. I stepped down. Do you know what I mean? Down to $16, down to nothing. And then all of a sudden I got raises, got a better job, and I no longer qualified for straight Medicaid. They had something called Medicaid for Workers with Disabilities. That program allowed me to pay for Medicaid. Not a lot of people were aware of that, those programs. And my payment for the last 8 years has gone up. As my income goes up, I pay more. And this is a program to let me work. Do you know what I mean? I've had back surgeries, Medicaid paid for them. Medicaid has stepped down, but you're right on. Trying to get a dentist since the Salvation Army closed, it's almost impossible. You mentioned the one place that takes Medicaid in this community. So, sorry, I lost my train of thought.
Move down to Karen. Do you want to hop in there and expand on your experiences?
Sure. So I think when we're talking about the dental side, you know, that's coming from obviously not enough providers accepting Medicaid, but we have providers who do not want to do practice management anymore. So you're seeing people that go into sort of boutique dentistry, and you're not seeing those hometown dentists anymore. But I think one of the things that we have to remember is that the unwillingness to accept Medicaid disproportionately affects children, seniors, individuals facing poverty, and those individuals with disabilities. And so on the early childhood side, one of the #1 ways that we learn to identify early developmental delays in children is through developmental screenings. And so those children are then allowed to receive early intervention services, which is in the child's home or community-based, wherever that parent feels comfortable with the child, to help their child not only receive the therapies that they need to get on track, but also to help that parent support the child. With that said, you know, threats to Medicaid undermine the opportunity for children to be diagnosed early and have those therapeutic interventions so that they can catch up and they can grow and flourish just as we want every child to do in our community. In Cambria County, we are 66 out of 67 counties for early intervention utilization. 1, we're not screening enough, and 2, once the screening has occurred, we have to make those successful transitions into having those therapies. Now, please keep in mind the #1 thing that children screen for in our community is a speech delay, but that can ultimately prevent them from being kindergarten ready. Also, the other thing to keep in mind is any child that is born prematurely almost automatically qualifies for early intervention programming. So these are factors that come together to ensure that our youngsters get off to the best start in life, and the very fundamentals of how this funding comes together and comes to the state are the underpinnings that allow these services to be available for families at no charge to them.
Thanks, Karen. Move down to Jim.
Okay, I'm Jim Cook. As was mentioned, I'm Chief Executive Officer of Cambria Residential Services, which provides intellectual disability services, primarily residential services. We also have behavioral health services. Jim mentioned from the information I sent him that I've been in the field over 40 years. That really isn't quite true. It's really 55 years. I didn't want you to think I'd fall asleep before you did in the audience. So I want to make a couple comments about Medicaid. The presentation here about how it's unfolded was exceptional. I really appreciate what you did there. I was in the doctoral program in public health. Nobody did it better. You're good. But at a higher level, now I initially wanted to be a clinician type, you know, but what I saw way back in 1968, that the bigger problem to help people was the systems. We had to develop systems that would help more people. My first job, I tucked my way into an internship in an old state hospital called Dixmont in 1968. And I was impressed with the quality of the people. They were trying to reform. The buildings were terrifying. They were from the prior century. They told us if there's a fire, just run. Don't try to save anybody. Let us do that because you'll get lost in here. It wasn't they weren't going to try. It was just like it's going to be a problem. It was discouraging. I thought about changing fields at that point. 2 years later, I had an opportunity to work on the first group home in Pennsylvania for intellectual disability. And we weren't sure quite what we could do, but we were to go out to the institutions. I had read about them. There was bipartisan support and studies from the 50s through the 60s that we have huge problems with how we've institutionalized people in the country. I'd read about it. I'd seen the mental health one. It wasn't too shocking. We were to go out and interview people in institutions for intellectual disability, which previously was called mental retardation. The first one we went to was Polk, up near Franklin, PA. As we approached, there were beautiful grounds and nice looking buildings. We stopped with a gentleman driving a tractor, and he was real helpful. And we found out he had been put in there 30 years ago as intellectually disabled, and he could drive tractors and stuff. There was no way for him to get out. There were no community supports. I thought, what's going on here? So we went into the buildings, which didn't look bad, and I had nightmares for 2 days, and things don't bother me as a rule, people tell you. There were thousands of people in space for 600 or 700. It was just unbelievable. We met with the administrator, and he said, please help these people, get people out. And I met with some of the staff. They said the same thing. But one staff person said, I know you gotta do this. We want you to do this. Are we gonna lose our jobs? And I said, yeah, the plan is to get everybody out of here. But I said, if it's any reassurance, I talked to policy people and budgeting people, and I said, it probably will not happen in my lifetime. I was 20 years old, and it wasn't no exaggeration, but I was wrong. I'm still alive. They closed it 2 years ago. It took 52 years to solve that problem. The state was really under pressure. Geraldo Rivera became famous sneaking cameras into some institutions up in New York. And when the public saw it, they say, why do we do this? We're proud of this country. Why is this going on? And then it was happening everywhere. It broke in the news in Pennsylvania about the conditions, and they're pretty deplorable. And I found out soon that the way that we got funding to do it was Medicaid. Medicaid has driven the system for 50 years. Now, you've all heard of Medicaid. Where it came about was in 1965, when Medicare passed, a companion bill that nobody paid attention to was called Medicaid. And the reason these two bills were necessary was, and I studied international affairs and public administration, and when I learned about health systems, almost all the developed Western countries had put together universal health care to take care of all their people. Our healthcare system was developing with the blues. They were developing private health insurance, which was dominating. After World War II, we focused domestically, and we said, we're gonna build an exemplary healthcare system. So there was something called Hill-Burton, some of you may have heard of. It was to build facilities, construct facilities, and all the hospitals were built with this Hill-Burton money. And their duty was then to provide some free care to serve some people. The large numbers of people uninsured, though, was still a problem. So Medicare got a lot of support to cover the elderly. And at the same time, there were poverty programs, Medicaid. But the key to Medicaid was there was a formula that said it's open-ended entitlement, and it's shared federal state. So the states, if they stepped up and wrote a plan and started serving more people, the federal government had to share. Facilities and medical education, medical research, it's not quite right if we have all these hundreds, millions and millions of people who can't access the system. That's the only place any country develops, the only one where we have all these people who can't access the health system. And they only get, if they're completely out, they get emergency services. I think people should have access to health care, and I think Medicaid should be part of it. Now, I followed this forever, and like I said, I'm not an alarmist, but in 55 years of studying government and watching this, this is the most threatening, frightening thing I have seen in 55 years. The charge, if you understand it, to cut the budget, putting $88 billion challenge to energy and commerce, which has Medicaid, Medicare, Social Security, and the biggest piece, Medicaid, to cut $88 billion. They passed a resolution saying we should do it. Many of the representatives, including ours, says we do not want to hurt vulnerable people. The two things, to me, seem incompatible. I think the threat is real, and I personally just think it's totally unacceptable in this country that we would risk pushing all these people out of our wonderful healthcare system we're so proud of. Now, in our field, the big issue with institutions was also in the community. We learned a lot about families who have someone born with an intellectual disability or a related type of disability, and it's really hard on the family. Institutional care, very expensive. So we had three challenges. One, move the people out of the institutions. Two, support families. and 3, divert people who would otherwise go into an institution. And we've been very successful. One of the institutions I visited way back was called Crescent Center. I think it's where the prison is up now. And I went there in the middle of winter. I was probably 21 then. In the middle of winter, we drove up there. And you people have these blizzards. And we're going up the Woodington Highway, and the next thing you know, I think we're in someone's yard. And I swore I'd never come back there. I was from Pittsburgh. And years later, I had 2 group homes on that hill. But I got used to it. But anyway, that one closed. They closed one after the other. Now there's only 2 in the state. All the really bad things. Evansburg Center is not a bad place. And Sealand Spray was open. So we achieved that. But we have a system of supporting families, keeping people in their homes, making sure they can cope, diverting anybody, almost everybody, from going into these centers so that they stay and never get crowded again. And then a system of group homes, and that's what I write. And the people depend on us for every aspect of their life, their daily living skills, their medication management, their doctor's visits. We try to get them employment. Believe in that, but most people we have are unemployable. In the system, because it's Medicaid, like people had pointed out, you can't get a dentist. We are bare budget. We're really tightly budget. We have statistics that show inflation is this, we're funded here. So we're always ratcheting down and trying to get by. We're not a big target of these cuts, I think, because they learned when they cut after 2008, it was catastrophic across the country when you cut the intellectual disability services, because we just implode. We're so close to just trying to stay open that if you do significant cuts, you're gonna have breakdowns all over the state, and there's really no easy solution for it. You can't go back to the institutions, they cost twice as much now. But if I wasn't here for that, thinking I'm not a target, I would have been here for these other presenters, because I've been an advocate, I belong as a board member of statewide associations. I know a lot about, not as much about the drug and alcohol, but the mental health services, and almost everything depends on Medicaid. And Rosalie, I heard the story from the clinic when they first opened, and I served on the board about 20 years because their mission is so critical. Rosalie has taken it to a whole new level. She's on the verge of really meaningful impact, and it's all threatened. So I just hope that you take what you're hearing today and you make your voice heard, because it's the right thing to do. You should be heard. We cannot blame our congressmen if we don't inform their discretion. They represent us. If they don't hear from us, don't blame them for what they do. So we follow through with that.
Thanks for all that information. The heart of the matter. It's a little political, just warning. Not that this whole thing's not. What have you noticed so far with what the Trump administration has done with Medicaid? It seems to get right to the heart of what we're here to talk about. What is the landscape as we're sitting here tonight? Who would like to tackle that?
I can just say, from studying a variety of executive orders and different pieces of public policy, that this issue with Medicaid, as well as many other programs that are facing cuts, is going to hurt our most vulnerable residents. And above all else, it feels like a penalty for being in poverty. And the reality of it is, it's an $880 billion cut to Medicaid. Also, they're looking at a $230 billion cut to SNAP. If you look at the overall federal budget, SNAP is less than 4% of the federal budget. So it really looks like big numbers, but you have to put it in its context. And again, these are all individuals who are struggling to make ends meet. And I will just add that as a United Way, we're also very interested in something we call the ALICE population in our community. And ALICE stands for Asset Limited Income Constrained Employed. So these are individuals that are working, oftentimes 2 or 3 jobs, and struggling to make ends meet. individuals are one financial emergency away from needing services themselves. But these are also individuals who may qualify for a sliding scale chip to maintain their children's insurance. So people should not be penalized for struggling. People should not be penalized for being impoverished. People should be given the tools and the opportunities that they need to thrive. And that's really what we're looking at here. Taking away the fundamental health care for folks will ultimately debilitate our community.
Thanks. I think Jeannine wants to follow up.
Yeah, I'm just really kind of piggybacking on what Karen was saying as well. We have some flyers up here if anybody's interested after. Several of the local health and human service organizations put together, as Chip mentioned, the Tribune's done a fantastic job highlighting some of the potential federal fallout. This fact sheet really is not only highlights what potentially could be impacted locally with Medicaid cuts, but some of the other cuts that the administration is targeting as well. And I think to your point, Karen, when you look at the sum of all of these things on this 4-page document, it is really concerning for our community. And I will say, Chip did share how many years I've been working in a public health capacity, and the past 10 years, but particularly over the past 5 years since the pandemic, we've seen such an incredible rally from our health and human service agencies in the community that address all of those 7 priority items that we talked about here earlier. Agencies working under that physical health umbrella, working on food insecurity initiatives, working on expanding public transportation services, mental health, substance use, all the gamut. We really have seen this all hands on deck approach to try to tackle some of these bigger issues. We talked about the shortage of dental providers. There's a major initiative right now underway working with the Pitt Dental School to try to build some of that capacity in the region. Work in all of these sectors under early childhood, for example. Local funders came together to hire an early childhood coordinator who wakes up every day, eating, breathing, and thinking about how we can help to address the early childhood crisis, get more of those children screened, get them connected to pre-K services. So we're really seeing some incredible momentum from all of our health and human service agencies working collaboratively together. And all of these threats that we highlight here are really, really going to undermine that incredible work to try to address some of those challenges. So I think it's not just the Medicaid piece, it's really all of these areas where we're seeing across the board cuts that we're really going to see, especially a community like ours with some of those challenges that we had, those underlying challenges already, they're just going to be exacerbated by some of what you're hearing today.
Yeah, and
Jason.
I'd like to weigh in. So there hasn't been any cuts yet. Chip mentioned I serve as co-chair of the Office of Mental Health and Substance Abuse Services Planning Council. That in turn allows me an audience with the Deputy Secretary of the office every month. I play the tape out as far as I can. I receive Medicaid. I'm a provider of Medicaid. My organization isn't on here because I'm grant funded and I don't want repercussions to the organization. It's been my dream for 14 years. But having that audience with the Deputy Secretary, she played it out way further than I could see. Most of the funds for our hospitals in Cambria, Somerset, and all my data is from PA 13 as a whole. But all of these places are small hospitals. If they lose that percentage of their income, they are gonna fail. Imagine, last January, I had my gallbladder out, emergency surgery. I don't think I could have driven myself to Pittsburgh for surgery. Do you know what I mean? If we're looking at an hour, hour and a half to receive emergency care, not to mention how many jobs do these places have? You know what I mean? First off, we know some of the largest providers or largest employers in this area, Conemaugh Hospital, some of the behavioral health providers. I'm sure Somerset, I'm sure UPMC is one of the biggest providers. If these places go off, not only are we losing jobs, which the people aren't gonna be able to have that, you know, a lot of times people are on this stuff short term or are on it to get back on their feet. There's not gonna be any of this funding. If our hospitals fail, everybody that works in human services or medical don't have a job. Like, this is, I don't understand, like, I think the whole city should be in this room. Like, there's not gonna be food for all the people that are laid off, that, you know, all the nurses, all the cleaning staff at the hospitals, and then you don't have health insurance, there's no food stamps. What's gonna happen to unemployment, seeing that Medicaid's one of the biggest pots of money that come from the federal government to the state. So like, that means like the money we put for roads are gonna be, you know, pulling from the state budget. Like, this affects every department that Pennsylvania has. It's just really scary, like, I don't know, I'll pass.
One other,
Also,
I'm sorry, go ahead.
So, in talking about who is receiving care and where the funding is coming from, and the locality of our hospital systems, right? You know, having the luxury of having a hospital close by. Think about this in context of maternal health, too. We have the worst maternal health of any developed nation. So just imagine what this will look like without the assistance of Medicaid should it be cut. And so really, it's not only the fact that you can't have a baby at any of these small rural hospitals anymore, but where can you have a baby? So, you know, we have Conemaugh, we have UPMC Altoona that people can go to. But if you don't have Medicaid and you can't go somewhere that accepts your insurance, we have a challenge. And so we have significant issues related to maternal health already, and this will really compound that.
We did get a question from the audience about how Medicaid cuts would impact local hospitals. I think we've kind of answered that. Anybody want to add anything to what was just said about the impact on local hospitals and the local medical system?
Just share some of the data, any little checklist here. Half of US births are covered by Medicaid. I think that statistic speaks for itself.
I have a question that kind of addresses a little bit about what I'm gonna bring up, but it very much hits on how hospitals are affected by this. So for a nursing home, it costs, I'm a nursing home administrator, it costs us about $360 a day to care for someone, when you take into account salaries and food and utilities and everything like that. Medicaid reimburses us $225 a day. So for every single person in the building that is on Medicaid, we lose $135 per person per day. A 100-bed home has 70 people in that building on Medicaid, which is about right. That's over $3 million a year of loss that home starts with and then has to climb back out. So then you start saying, okay, well, how do those places stay in business at all? Well, that comes from private pay or from the insurances. So often we're talking about Medicaid as it affects, you know, people who are lower income, or people, you know, have been affected by different things, they just don't have the money to pay for these things. Well, if you can't live at home, you don't have the family support that you need, or your care needs are so high that people can't give the care that you need. If you're gonna private pay for a caregiver in your home, that's anywhere from $25 to $30 an hour. If you need 24-hour care, that's $22,000 a month. That's gonna cost you just for your care. A nursing home, private pay, is anywhere from $12,000 to $15,000 a month, because we have to make up for all the loss that we're taking because of Medicaid. And so now you say, oh, well, here's this person, worked hard their entire lives, saved up their money, did every single thing right that they're supposed to do, and they've got $250,000 in the bank that they saved. How long do you think it's gonna last? That's 10 months of private pay. You know, it's about 2 years for a nursing home. So this affects absolutely everybody, and as that hits our hospital system, the reality is that even before these cuts were discussed, because of how much agency staffing costs and the state refuses to put any caps on that, nursing homes are going out of business left and right across the state of Pennsylvania. So they're either going.
Your days.
Yeah.
How many of your days is MA? Or MA managed care?
Right now, I've got
50%?
over, yeah. I've got 78 residents in my building right now, and 56 of them are there.
So half the births are Medicaid, half the, and I'm a finance guy in long-term here, half the patient days are for nursing home folks are MA, and both are financial losers for the provider.
And so, when you look at all those closures that are happening, when you hear those stories of people that are sitting in an emergency room, not a bed, in a chair outside of emergency room, or on a gurney for 3 days out in a hallway of an emergency room, that's happening because those hospitals cannot find placement for the people in their building. A survey was done last year, 79 admissions for the hospitals because they did not have the staff to care for the people that were there. They couldn't take any more admissions. So now those hospitals are looking and desperately trying to find a placement. So you're not getting the care you need when you go to the hospital because you can't get a bed. And now that hospital is looking 2-3 hours away to find a placement for somebody. So now your mom broke her hip, she needs care, and all of a sudden you find out that mom from Johnstown just got placed in Philadelphia. These are like real things that are happening right now before this happens. So how much worse do you think it's going to get when they start making cuts?
Any response from up front?
Yeah, I was just gonna add, I mean, that really, we didn't really talk about that, not only are we talking, we're talking kind of the high level potential cuts, from a Medicaid perspective, but prior to this, as you well know, Medicaid was already a loss leader. It does not reimburse dollar for dollar for that cost of care. And so when you have demographics in our region like we do, where not a significant portion of the population relies on that coverage, significant portion of the population relies on that Medicare coverage, which on average reimburses about dollar for dollar. You're not making a lot of money there. So when you look at those demographics in our region, we're already at loss, and now any potential drawback to that is going to compound the issue. Again, just only the socioeconomics already existing in our region.
Here's a very interesting question that came from the audience, and I'll just read it out loud. Some people I speak to aren't concerned about possible cuts to Medicaid because they believe the cuts will only impact waste, fraud, and abuse. How could I respond effectively to someone who believes this? Anyone on the panel want to go after that?
I think it's been clearly demonstrated that a lot of what they call waste, fraud, and abuse are administrative errors. And back in 1978, when we first looked at data, it was about 4 or 5%. It's still probably about 4 or 5%. And part of it is there's a huge, Medicaid is a federal state program that's state administered. It's very hard with all the transactions that happen every time someone walks into a doctor's office. Tracking all this is complicated. Eligibility is complicated. There's always going to be a small error rate. It's not big. It would not allow you, it would cost a lot of money to find stuff, and you would not save $88 billion in 1 year. That's not even close. So that's always a smoke screen to say we're just going to cut the waste, fraud, and abuse. You can't get to their goal, cutting waste, fraud, and abuse. And they're always working on it. They've been working on it forever. There's audit panels, everything that look to recover. When you get audited by Medicaid, usually you lose dollars. I don't know nursing homes if you guys fight that. If you get audited by some of these racks they call them, you hand back money. But that's not the answer. That's
What specifically are they talking about when they say fraud? Fraud to me would be something like somebody's supposed to do something and they don't do it. Or they say that they're going to provide this in a program and they don't provide it. That sounds like something that would be fraudulent. So what specifically are they talking about that has been going on in all these different components of where you people work that can be identified by those words. Otherwise, it's just a bunch of words. It's like word salads. They don't specify what each of those things actually mean and how they can be identified.
Anyone else?
So I will say, oftentimes when you're looking at fraud, there were many years where the state of Pennsylvania had a model that was client-directed services for individuals with disabilities. This meant that they had a fiduciary agent, which was usually a nonprofit organization, and they would manage the money for the client, but the client could direct the services the way that they wanted to. Well, there were certain things within that budget that people were allowed to do, like travel to medical appointments. But if they were claiming to travel to medical appointments and they weren't going there, that could have been interpreted as fraud related to those waiver programs. That particular waiver program does not exist anymore in the Commonwealth because of concerns around waste, fraud, and abuse. So you will not see a self-directed care program anymore in the Commonwealth, and it is expressly for that reason.
And you can see, and we have seen at the clinic where people who have substance use disorder or come in asking for pain management might doctor shop and go from one doctor to another to see how much pain medication they could get. That could be fraud. But there's a system in place that we can check to see what medications individuals are receiving in order to minimize the patient from doctor shopping to get more pain medication. That could be, but again, I think Karen said it, or Jim said it. You don't want to put the blame on the person that needs it the most. You want to find fault with the victims. That's not okay. People need help. People are vulnerable. The medical care right now is not enough. And to take away from what is not enough is devastating to me. I am worried, I am scared.
Here's a good follow-up question from the audience. How can we advocate for our clients? And what resources can we utilize to supplement and ensure services can still be obtained in the event that Medicaid is cut as drastically as we suspect it could be? Jeannine's jumping on.
I'll start. I heard somebody say the other day, how impactful, the data, when you look at the numbers on the screen, that's one story. But personalized stories, I think, make such a big difference. Hearing Jason sharing his testimony on how Medicaid impacted him personally, advocating on behalf of your clients, encouraging them to share their stories as well, and make sure that they have the information to reach out to their legislators to be able to share how Medicaid or any other support services have impacted them, I think is so powerful. We've got, I think, one media partner left here, but sharing those stories, in the media to be able to lift those up, those personal stories, I think, are really, really the key to getting that message out there. So encourage all of your clients to take that platform and share their message.
Anyone else?
We have to find our voice. They talk about my credentials. Well, those are just words. Who I am as an advocate, I'm the one that looks in the faces of the people who are on Medicare. I touch their hands, I know their families, I know their treatments. They're not coming into the clinic to take advantage. They're coming in the clinic because they need medical care. Medical care that we have to give them. Medical care isn't a privilege. It's a right. And for the government at this point in time to think that they can take $880 billion away from Medicare to give to the people that have, is not acceptable. And if we're gonna do something, we all have to find our voice. We have to go back to the time when we do grassroots organization. And I remember that in the 1970s. There was a program called the War on Poverty, Office of Economic Opportunity. And me and Jim, we probably the only ones in this room that.
You must be younger.
No, I don't know, I'm going way back there. But that first job of mine, I was reorganized. And I remember one of the first things that group wanted in Prospect was a black-faced mannequin in Gloucester's window. And they wanted to tear down dilapidated buildings, and they wanted better health care, and they wanted better education. But here we are again today, talking about the same thing, except now they would remove that black mannequin from Gloucester's because they're eliminating, okay, the word, diversity, equity, and inclusion. This is not okay. Victim services back in the day, I was not allowed to advocate for a victim in the hospital when she asked me that she needed help. I was escorted. Their records were not confidential. They wanted to put me in jail. They're putting people back in jail. They're sending them without due process to places to probably die. We can't allow that to happen. We're in another war. We're in the war for health. And I am fighting for patients with no health insurance, and we know about the patients and the physicians and the providers who won't take Medicare. I've been with this clinic 12, 13 years, but it's been in existence for 27 years. A lot of people don't know about it, but its mission is quite beautiful: to provide medical, pharmaceutical, and wellness services to the low-income, uninsured, and underinsured in the Laurel Highlands region. What's gonna happen? We work on a shoestring budget. You know what? We haven't skipped a beat in helping people in this community. During COVID, we reached out to 14,000 people, and you know, some people didn't know this, but big pharmaceutical companies got big money to give COVID shots. They made millions. We couldn't be eligible for that. My vulnerable low-income people that were homebound would have never gotten a shot if it wasn't for the free clinic. We drove with volunteers to their house. That's what it takes. It takes an upswell of the community to rally the volunteers to be willing to educate the people that are in the most need. They're not voting. They're not voting, and those votes count. If people understood what we're facing, maybe they'd go to the polls. I know that last year we served about 1,200 patients, and 90% of them are on Medicaid. Most adults on Medicaid are who cannot work due to a serious illness or disability. Medicaid is vital to low-wage workers. It's keeping them employed. If you're not a healthy person, you're not a productive person. You can't pay taxes. So take away their Medicaid, and then what are we supposed to do in this society? You know, and right now, Medicaid's a poor payer, you've witnessed that. We just, at the clinic, we just started to get reimbursements from Medicaid. It doesn't cover our charges, like 20%. You know, we have to go to the United Way, thank God, the Lee initiatives, just to keep our doors open. Hospitals are feeling the impact. I just recently read something that on an average, an uninsured individual costs a local hospital about $2,000 in uncompensated care expenses. You know, you add that up for every uninsured person, you're talking millions and millions and millions.
And nobody should have to use Kickstarter as supplemental insurance.
Several years ago, we did a study with Conemaugh Hospital to see if the impact of a free clinic, such as Highlands Health, made a difference in the reduction of the emergency room visits and hospital admissions. And on very small sampling, overwhelmingly, we saw that a free clinic, a Highlands Health Clinic, saved the community almost $800,000. So now we want to take things away from the very programs that result in the savings for the multitude. Right now I feel like I've failed because there are so many people who need us. Looking at the statistics, we could be faced with 116,000 people in Cambria and Somerset County that are going to lose their benefits. And last year, we only served 1,200 people. And part of the statistics say that less than 1% of our folks are having their health care needs met. I don't know how I don't know what we're going to do. You know, I'm afraid, it truly is a war for health. And in my opinion, it's a conflict with those who are trying to take away from those who have not. If these cuts are made, the consequences will be devastating. We will see an increase in crime. We will see an increase in drug use. There will be more mental health crises. You will see suicides. The strain on emergency rooms, schools, shelters, and jails will only grow. And while we're recovering for the COVID pandemic, new threats are already emerging. And get ready, the bird flu is mutating and spreading to other animals, and it has spread to humans. Measles are on the rise. 750 cases have now been reported. Yet, the CDC has laid off staff. Vaccine research has stalled, and some national leaders continue to undermine the trust in science and public health. You think we got a crisis? And then our medications. Most of our medications come from overseas. They want to leverage tariffs on products such as medications coming into the United States. Now our medicine's going to get more expensive. Life-sustaining medication that people need to live day in and day out. It's all about the haves taking from the have-nots. You know, we fought that war on poverty again. We got to fight the war for health. We got to find our voice. We got to raise our voice. We got to swell up from the ground. We got to swell. We got to let our legislators know how we feel. We cannot be afraid. We got to be loud. We got to be strong, and we got to vote.
Anyone dare to follow that up?
Yeah, so there was another war on drugs, and that's where some of these talking points come from. You hear about the fentanyl crossing the border. prior to COVID, when our representative would have those telephone town halls, they'd never take my question. They talked about the fentanyl. I said, do you guys realize if you eliminate the demand, the supply goes away? Like, this is pretty basic. So why don't we put some funding towards substance use disorder treatment? Some mental health stuff, because there's a mental health epidemic that drove the opioid epidemic. If you want to see more about it, watch a documentary, Tipping the Pain Scales. It's amazing. So this war on drugs is being brought back. It's like they got these talking points that, like, the fraud, waste, and abuse, the fentanyl, and it's almost like they survey people what's going to catch on, and like the reality is, if we eliminate the supply, we eliminate the demand. We're looking at, so I am the executive director of Recovery Community Center, and a lot of what I do is based out of what didn't exist when I tried to stop using, right? I got out of jail with no meds. I don't know if you know, but it's like under 90 days, most people reoffend. Well, you get out of jail with 3 days worth of psych meds, you have a mental health condition, and it takes 6 months to get in to see a psychiatrist. Do you see why people end up back in jail? So like, I don't know if you guys caught on, but I'm not the data person on the panel. So like, I'm the kick in the door and let's get it done and help this person. And what I do is I recognize those other people in the community, Rosalie being one. We just started a program with probation where they drive people from the jail directly to my front door, walk in the door with them, and the first thing I do is get their MA turned on. My second call is to Rosalie. Rosalie writes, this is like what I call community hacks, because there's so many social determinants of health, or as I call them, barriers. Rosalie gets me a bridge script. Do you know what I mean? Like, we have a list of meds they were on from the jail. We need that bridge. Like, let's try keeping the people on the psych meds that keep them okay, so they can stay out and not self-medicate with opiates or fentanyl or uppers. I gotta give a little shameless plug. Like, I just saw in the paper, like, the overdose rate came down over the past year. We've been in business for 1 year. I know it's not all us. But that's pretty cool. You know what I mean? We had our first year open, we had like over 200 people through the door. You know what I mean? We provided life-saving Narcan. We have people, like the first wave of folks coming out of the jail in this new program, in the past 2 weeks, they all got jobs. Like, we had 12 people a day putting their roots in the early recovery, and now they stay with us because a lot of us, we get a job, and that becomes our main motivator, that becomes our recovery, and then when life shows up again, you know, we pick up because that's what we're used to. We're able to help people stay in their path to recovery while re-entering the workforce, and then find a livable wage job after that. Do you know what I mean? Like, don't you think that's better than like trying to bust the 1 kilo a year that comes across the border from Canada? You know what I mean? Like, we just put millions of dollars of that. Like, it costs our county, Cambria County, like $130 a day to keep somebody incarcerated. Like, if you gave me $130 a day, I'd get a lot of shit done. I don't know. And we also, I just want to say, we also help families. We realize the devastation, and there's like a new thinking for family recovery. That old thinking of let people hit bottom, that doesn't work in the era of carfentanil. We had to come up with new strategies. That idea that came from Alcoholics Anonymous from the 30s of let them hit bottom doesn't work when you're talking about them. That works when you're talking about a wife throwing her husband out because he drinks too much. That doesn't work with a 19 or 20-year-old kid telling their mom to throw them out. So we got to think of new ways to serve the family, new approaches, recognize that they're not enabling, they're acting upon their own trauma response because they're watching their loved one die. You know what I mean? We have all kinds of new thinking, all kinds of family stuff going on. There's still no magic wand to help your loved one. but we can coach you up. We can help expedite that process of them getting the help they need. So, heck with the war on drugs, and I don't know. I love people like Rosalie. I was really happy to see our name tags, because she's in the last, I don't know, 6 months has probably done 5 or 6 bridge scripts for me, bypassed the intake process, because this person's gonna run, they get out of jail Friday, they're gonna be out of meds by Monday. Rosalie's come in on the day off, had me on the phone with the doctor while they're walking their dog to get this person meds. Do you know what I mean? Like, this is the people I look for in the county to like collaborate with and get shit done. As Shapiro says, I've been doing it longer. That's all.
But I think you both bring up something really critical in the fact that, this is all boots on the ground. This is people who are working in the field, we're seeing the trends, we understand what's happening to the people we serve in the community. But the one key thing in this is the moral imperative of a government to pass a budget that does the best by its people. Not just some of the people, but all of the people. And that is something that we have to continue to bring to the forefront. Yes, we're saying cute little words like fentanyl at the border, but that's not what's happening. And
Right.
we know the reality of the situation. And it's time that we go and share this truth with our local legislators and say, nope, that's not how this works. Politics is the only field where you can get elected and have zero knowledge of anything that you're really talking about. And let's be honest, now nobody shows up like, oh yeah, HHS, I should be running that department. That is not how this works. And so you have to remember that these are folks that do not have a solid knowledge base in these fields. So continue to educate, to provide those opportunities, to say, here is how things work in our community, and this is what's happening. But again, the moral imperative to do something for all people, not just some of the people.
Like the presidential election doesn't usually affect me too much. You know what I mean? I might feel a little bit of something. One year I might get a child tax credit for being a single parent. One year I might not. And I think a lot of the people that are going to be affected by this Medicaid cut just thinks it's another election. Do you know what I mean? It usually doesn't really affect me that much. Well, that's not this.
That's not this.
That's not this.
This is not this.
It doesn't really matter which side held, before this. I mean, I might be affected a little bit, something might go up a hair, I might get a tax credit, but I never lost my health insurance, my livelihood, and did that along with, a third, 2/3 of my community all at the same time. Yay.
They're strict in numbers.
Can I say
But
something?
you guys didn't listen to me. All of you, I see a lot of you that were with me Thursday. You were supposed to bring 2 people with you. So make sure you bring 8 people with you on Saturday.
Yeah, if I can interject it, our representatives, they know what we've been talking about. They know how important this is, what we're up against, and what got us. I don't think they wanted to target Medicaid or Medicare or anything. The biggest driving force behind this was a tax cut that the president passed in his first term. And the tax cut is set to expire this year. And the reason it was set to expire this year, they wanted to get past the next administration, but the reason it was set to expire was that when they pass a tax cut or they propose it, there's a independent group that has to score it, and they have to say what it'll do to the deficit. And the deficit was rising with the tax cut. They denied it would happen. They just said the economy will pick up, will pay for itself. They only had it in to stop the actuaries from calculating any further, because if they had, they would see the deficit continuing to skyrocket. They want to extend this tax cut. So among their group, there's a powerful subsection of the group that says, we are all about the deficit. It will be bad for the country. They say, that we won't support anything that keeps increasing our national deficit. So to get both, to get the tax cut and stop the deficit from growing, you have to make massive cuts in government. And that's what it's all about, is there's tremendous pressure on these representatives to go along and allow the tax cut to be extended and make them permanent. And to do that, to get the deficit hawks on board, you gotta do massive cuts in spending. And so they know this is serious, and all of them are saying, we're really concerned about Medicaid. But then they're getting this tremendous pressure, and they already passed a resolution saying, okay, we'll give you your spending cuts, so we can have the tax cuts, and we promised to deliver the tax cuts. So they're stuck. If they're gonna deliver the tax cuts, they have to have the spending cuts. If they get these spending cuts, they're gonna devastate a lot of things. They don't even talk about what they do to Medicaid, but when people look at the goal set for energy and commerce at 88 billion, they say, how can you do it? The biggest thing is Medicaid. And they never used the word. They just threw it to energy and commerce and said, come up with 88 billion. So if they don't find the 88 billion, they either have to run up the deficit or reduce the tax cuts. So it's gonna be very hard for them. They need to hear from everybody. We need to tell them two things: that we do not want Medicaid in our community devastated along with Medicaid. And the other thing you have to do when you write to our congressman is to say, we really want you to free Rosalie Danchanko, bring her back from El Salvador. The things she said tonight were just Rosalie, you know, it's like, we support her.
We have a bunch of hands up. We're down to the home stretch. We'll just try to catch every question real quick. We'll start right down front.
James, I need you to elucidate what we need to say to our legislators as to what you just repeated. Because I'm trying to write it down, and I have a mess here.
Okay. If you can give emails to somebody here, I can send out sample letters and stuff like that. Hey, you have to personalize them. They do not care about petitions. They care about personal letters. Here I am, I'm your constituent. I really care about this, and I really want your support. Leave this alone. It has to be personal.
We'll make sure also from the Locals for Good to make sure we have all that stuff on our website. So if you're willing to work with us to put that together, we will help.
And I just want to reply, it's really important, there's a lot of letters. Like, I wrote a letter, but I also went and got more people to write letters, because here's the reality. Our representative doesn't fear us when 50 of us are showing up. You know what I mean? His threat, what he's scared of, is being primaried by not going along with the train. The only way to change that is for thousands and thousands of letters coming in. For him to say, I had 200,000 more votes than my competitor. So we need 200,000 letters to go to him. Do you know what I mean? Like, right now, his only fear is being primaried because he doesn't go along with the train. So like, he has to be in a pressure cooker to even start thinking about not doing this. I'm sorry.
We'll go here.
The best piece of advice that I ever got when it comes to legislators, and this would be great if everybody would do it. Reaching out with a letter and a phone call and things like that, they're great and they're very important. But if that's the only time your legislator ever hears from you, it's not going to be effective. So if the only time you talk to your legislator is when you have a problem, they don't care about you. They're just looking to get you out of their office. Instead, develop a relationship with them. Call them multiple times. You can call any of their offices and say, hey, I'd like to meet with the senator. I'd like to meet with my congressman. When can I do that? And they'll say, oh, well, they've got an opening on Thursday. Could you come down? I reached out to Rigby's office. I was hoping for 15 minutes with him. He let me talk with him for 2.5 hours in his office. Anybody can do that at any time. And if they know who you are, then when you need to get things done, then you call and you say, hey, I noticed that this is happening in hospitals. Is there legislation that we can pass to fix that?
And they go, yeah, let me look and see what it is. Oh, it's in this House bill here. Well, is the senator going to support that? Yeah, we'll make sure he does. So you have to go repeatedly, and not just when you're like pounding on the door with your pitchfork, but just like, hey, how you doing? That's how you actually get things done, not just the one time with a letter or an email. You gotta go over and over.
But this one time has to be done.
Yes.
This one
That
time
and.
has to be done. I mean, whether you've done it or not, now you're gonna learn.
Anyone else over here?
There was a hand up toward the back. You still have a question back there?
Back here somewhere?
This
Bring it
has
like
her
that
hand
way.
up a long time. Up here?
Being patient.
You did address a little bit of what was on my mind as the haves and have-nots. Since they deregulated banks, I think around 2008, they repealed a lot of the acts that kept corporations under control. And I know like in the 50s and 60s that the corporations had community-based concerns. They kept their money in the communities. There was a trickle-down economy, and now we're not seeing that. We're seeing the tax cuts for the super wealthy. I think in 2017, the tax cut that was enacted then, a lot of the companies made multiple billions of dollars from those tax cuts. What can we do to have that kind of thing stop? Because that's what's really hurting us as a people. All these other things are distractions to keep us from seeing what they are doing through these corporations and billionaires, and we're losing our democracy because of that, and we are losing our communities. What can we do to fight that type of system?
I think you just said it. I really think you just said it. It's educating people with that voice of yours right now, because people don't understand that. You have to talk it.
Our labor unions have gone down to 6.4% participation. They are advocates in receiving fair wages that have been stagnated for decades.
It's interesting that you would say that, because our family is long-term union carrying members. And my husband said that tonight. He said, we need to bring back the unions. They really helped us fight for what was right.
And they are struggling too. 3 people with mental health, we had 3 union members commit suicides. Our young men in 30s with families because of the situation of what's going on.
Yeah, I'm sorry.
What's going on?
Yeah, that's not okay.
No,
I'm
it's
sorry.
not.
And I mean, there are fronts, we need the funding. I have a good friend that is taking peer support into construction sites, training construction workers to provide peer support to other construction workers going through mental health and substance use crisis. Like, there's a lot of good work going out there, but it's not gonna evolve if we have funding cuts.
Yeah, and the right to work states, they're breaking the unions, they're breaking our voices to be able to provide for our families and make a living wage, not a substandard wage, a living wage.
Which I work closely with Goodwill, the Southern Alleghenies, which I was surprised to find in Johnstown is over $20 an hour. Like, that blew my mind, and that's based on like our area. That's not like across the state, because I thought I was paying a livable wage, and apparently I'm a couple cents under that.
I think to your point, and it kind of goes back to your comments as well, the fact that you're all here and advocating, the fact that we have, our local media elevating these stories and elevating, the dire situation, I think is the first step, and it's continuing to carry that torch. And Chip and I were talking earlier, and I've had multiple conversations with friends and family, finding something that resonates with other folks, I think is really important. Using, stat sheets, information, anything that you find from a reputable source on, online, and sharing that, bringing 2 people with you, how many people? 8 people with you on Saturday.
Yes.
There really is power in numbers, and there's power in going and meeting with your legislators, and I've had the same experience with Representative Rigby as well. So I think continuing that advocacy, I don't think that if there's any takeaway this evening, it's just continuing to provide that voice for, whether it's yourselves or advocating on behalf of other vulnerable and marginalized folks in the community.
And I would just add, talking about your point of the living wage. So United Way always has an advocacy platform, and I will be in Harrisburg on May the 13th to talk about the earned income tax credit in Pennsylvania. We are one of the few states on the Eastern Seaboard that does not have an earned income tax credit. The only other one is West Virginia at this time. And so we did a study to determine what the benefit of an earned income tax credit is for Pennsylvanians. And it has the ability to solidly move people into middle class. And there's an $11 return on investment between the savings from social services and the local money going back into the economy. So if you take one thing away in terms of something that you want to explore as a Pennsylvanian, look at the earned income tax credit for Pennsylvanians, because it will truly make a difference for the bottom line of our citizens.
Okay, folks, we are past the 8 o'clock hour. I was trying to tell you, we tried to be honest and say 8 o'clock is when this thing ends. If there are any last questions before we kind of walk away, I don't want anybody to feel as if they didn't get to ask one of these great people a question. Ed.
Have any of you on the panel heard of any specific comments from our Pennsylvania senators, McCormick and/or Fetterman, about these cuts?
I have not. I work pretty closely with the Medicaid Works for PA Coalition, and I asked them when I was hosting the town hall last Thursday if I should focus at all on the senators. They said not really. Like, this stuff's coming out of Energy and Chambers first. Like, they're the ones that have to find the $880 billion to cut. I attend those meetings all the time. I'll be doing something to reach out when the time comes. These people were more educated than me. They got me a 7-page fact sheet on PA 13. They haven't started working on the Senate yet, so.
I'll answer that question about the senator. I shared this at the other meeting that you guys had. We were on a phone town hall with Dave McCormick, and he had a question from a constituent about Medicaid, because this woman had a son who she was worried about the cuts, and he really kind of cut her off, and he said, just don't worry about Medicaid. He said, you know why? He said, because the president said he's not gonna cut Medicaid or Medicare. And then he went into the session where they passed the budget proposal that took $880 billion out of Medicaid. Now, either he lied to that woman, or he didn't want to answer her question, or he actually believes that President Trump will veto that budget when it comes to the desk. So, one or the other, he's got to be, I don't know, but just not honest with us.
All right, thank you very much.
We have one more. She's been waiting all night.
Fair enough.
I would like you to think about, I won't prolong the meeting tonight, but I want you to think about what is our goal on Saturday afternoon. Who do we want to be seen by? Who do we want there? is the media going to show us on the 11 o'clock news, but what is our goal? And the other thing I really implore you to do, some of the other rallies I've gone to, the signs are very vulgar. There are children there. We're trying to get young people involved. Make your sign be honest, but we don't need the profanity and we don't need the vulgarity. I think that's not good. I would encourage you to leave that out.
Any last questions or comments?
Thank you all for being here.
Real quickly, there you go. Raise your hand. I really want to thank the American Democracy Scholar Program here at UPJ for hosting us here in this fantastic facility. Thank you very much to them. Thank you also to Locals for Good and all the good you're doing in perpetuating these conversations and hopefully making a difference at the legislative level at some point. And
I should have said in my introduction, I don't believe that I did, that we made a very careful point of inviting Representative Joyce. We also invited our state and local, our state and senator representatives to be here tonight, because although this is a federal matter, you know, if our local hospitals fail, boy, it lands right in their district.
Yeah, and if you're wondering why we did this the Monday after Easter, because the timing is terrible, this was the only day that all of our representatives from their state level the whole way up to our senators were available. Not a single one of them are here. But we did invite them.
And just an FYI, our state reps know PA Secretary of Health and Human Services, Dr. Mal Arkush, gave them each a summary of their district and what this would mean to them. She's broke it down for each representative and senator, so they know exactly what this would cost.
all right, thank you to our great panelists. Thanks for being here. Thanks to all of you for taking your time.